Welcome to the Maternity Mentor. Today we will be talking about subchorionic hemorrhages and why it's important to get treatment fast. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Subchorionic hemorrhages are the most common abnormality found on ultrasound. They are also one of the most common causes of bleeding during pregnancy. Let's explore what causes a subchorionic hemorrhage and how to treat them. A subchorionic hemorrhage may also be called subchorionic bleeding. Subchorionic hemorrhages occur in 1 to 3% of all pregnancies. They are a collection of blood that forms between the placenta and the uterine wall. When this happens, it can lead to vaginal bleeding. Subchorionic hemorrhages usually occur early in the pregnancy and are the most common cause of bleeding during the first trimester. They may also cause bleeding in the second trimester of pregnancy. Any bleeding during your pregnancy should always be brought to your provider's attention because there are many causes for bleeding besides a subchorionic hemorrhage. Unfortunately, the causes of subchorionic hemorrhages are not very well understood. One theory is that the hemorrhage may be formed when the placenta detaches partially from the uterine wall. The placenta is the organ that brings your baby nutrients and oxygen during your pregnancy, as well as removing waste from your baby's body. Another theory is that when the fertilized egg attaches to the uterine wall, the attachment isn't quite right. This abnormal attachment may lead to bleeding and a subchorionic hemorrhage. This type of bleeding may also be called implantation bleeding. Many subchorionic hemorrhages never have any symptoms and are only detected on ultrasound. If symptoms do occur, it's usually in the form of bleeding. Smaller hemorrhages usually result in spotting, while larger hemorrhages may cause heavier bleeding. Other symptoms may include pelvic pain or cramping. Most subchorionic hemorrhages do not cause any complications, and in fact, they may reabsorb on their own. However, in rare cases, the placenta will detach from the uterine wall, which is a placental abruption. Complete placental abruptions are medical emergencies because they can cause death to both mom and baby. Usually, a mother will experience vaginal bleeding with severe, constant pain and discomfort in the back or belly prior to the placental abruption. Suddenly, the pain will disappear. That is the moment the abruption happens, and it requires immediate delivery of the baby. It's extremely important to get any vaginal bleeding checked out by your provider, whether you have pain or not. Subchorionic hemorrhages can also lead to miscarriage, premature rupture of membranes, and preterm labor. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about risk factors for subchorionic hemorrhage. There is still a lot of research ongoing about what places a mother at risk for a subchorionic hemorrhage. Assistive reproductive technology seems to be the main risk factor. Assistive reproductive technology includes in vitro fertilization embryo transfer, gamete intrafallopian transfer, zygote intrafallopian transfer, and frozen embryo transfer. While the risk does seem to be greater with assistive reproductive technology, most women will not have any complications from the subchorionic hemorrhage. Other risk factors may include maternal age, multiparous mothers or mothers who have had more than 2 babies, especially if they also had pregnancy losses, and the use of anticoagulants or blood thinners during your pregnancy. For most women, diagnosis starts with having symptoms. When a mother experiences bleeding during her pregnancy, she should report it to her provider. The provider will then try to determine the cause of the bleeding. This starts with a physical examination, looking for the cause of bleeding, such as a vaginal or cervical tear. Your provider may also order some blood work, including a CBC and pregnancy hormones. Bleeding can be a sign of miscarriage, so reviewing your hormone levels may tell your provider if this is what is happening. The CBC will look for anemia, which may provide direction for further investigation by your provider. Finally, an ultrasound may be ordered. Ultrasound can be used to see where the areas of blood or subchorionic hemorrhage is located in the uterus. The ultrasound can be used to visualize and see how well the placenta is functioning. It can also be used to look at your baby, check its development, and check the heart rate, depending on how far along you are in your pregnancy. For more information on anemia and blood transfusions, please see our video on this. We will link that in the description below. For most subchorionic hemorrhages, no treatment is required. In fact, a good percentage reabsorb into the body without any treatment. For some women, however, further intervention may be needed. This includes avoiding strenuous activities, no heavy lifting, avoiding standing for long periods of time, restriction from sexual intercourse, avoiding excessive exercise, and making sure to get a lot of rest, possibly even bed rest. Your provider may ask you to drink plenty of fluids and advise you to take a stool softener to prevent constipation and straining, which could cause you to start bleeding. Rarely, your provider may place you on blood thinners if a clot has developed in an effort to try and get the clot to come out. They may also prescribe estrogen or progesterone if the risk of miscarriage is high. For many subchorionic hemorrhages, your provider may choose to get a specialist involved in your care until the hemorrhage has resolved. The specialist recommended is usually a perinatologist or maternal fetal medicine physician. This provider will monitor your pregnancy to ensure your baby is doing well and monitor the course of the subchorionic hemorrhage. Most subchorionic hemorrhages pose no problems to a pregnancy. In fact, many go undiagnosed and undetected by both mom and provider. We still don't know a lot about subchorionic hemorrhages, and research is ongoing. Studies are conflicted about the effects a subchorionic hemorrhage may have on a pregnancy, so it's very important that if any bleeding is seen during your pregnancy, you contact your provider immediately. When symptoms do occur, correct diagnosis and careful monitoring can ensure that if a complication does arise, prompt treatment can begin. Remember, whether symptomatic or not, most mothers will go on to deliver a healthy full-term baby even when diagnosed with a subchorionic hemorrhage. Bleeding during your pregnancy can be very scary, but not all bleeding means miscarriage. I hope this has explained what a subchorionic hemorrhage is, the symptoms to look out for, and why it's so important to call your provider if you have any bleeding. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit the like button and subscribe so you can be the first to receive this information. Remember to share our channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.